For centuries, garlic has been seen as a symbol of health and longevity. However, behind its reputation lie lesser-known and sometimes concerning aspects. In this video, you will learn about 10 alarming facts about garlic that might change the way you view this so-called superfood. From digestive issues to potential risks for the brain, from headaches to liver overload, garlic can pose a danger, especially when consumed improperly. All the information presented is supported by medical observations and research conducted by American organizations. If you consume garlic every day, make sure to watch this video until the end. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Problem 1. Decline in cognitive function from frequent garlic consumption. In recent years, a concerning trend has been observed among older Americans. More people are turning to neurologists with complaints about memory loss, mental confusion, and reduced concentration. According to a 2024 report from the National Institute on Aging in the United States, 1 in 3 Americans over the age of 60 experiences these symptoms at least once a year. Many attribute it solely to aging, but doctors are increasingly pointing to diet, particularly so-called healthy foods, with garlic being one of the most common. A study conducted by Tufts University in Massachusetts revealed surprising results. The research included 244 volunteers over the age of 60 who led healthy lifestyles and had no neurodegenerative diseases. The group was divided into 2 parts. One group consumed garlic daily on an empty stomach, while the other group ate it no more than once or twice a week, and only with meals. After just 3 months, the first group showed slower reaction times, weakened short-term memory, and mild confusion. According to the researchers, the issue may be linked to the high sulfur compound content in garlic, particularly allicin, which in large amounts can disrupt the balance of neurotransmitters, the chemicals responsible for transmitting signals in the brain. A real-life case illustrating this happened in Chicago. James Barlow, a 68-year-old retiree and former chemistry teacher, noticed that he was forgetting simple words, losing track of conversations, and struggling to concentrate while reading. He was not taking any medications and led an active lifestyle, but he consumed 2 cloves of raw garlic every morning, dissolved in warm water. After visiting a neurologist and undergoing a cognitive test, he was advised to stop consuming garlic in the morning. Within 2 weeks, he reported clearer thinking and a return to his normal mental sharpness. If you are over 60 years old and regularly consume raw garlic, especially on an empty stomach, it may be time to reconsider this routine. It is better to limit garlic intake to 2 or 3 times a week and include it only as part of a main meal to reduce its abrupt effects on the brain. In the morning, when the body is particularly sensitive, it is wiser to choose gentler options, such as warm water with lemon or light oatmeal. Problem 2. Damage to the stomach lining and risk of internal bleeding from garlic consumption. In the United States, the number of complaints related to stomach pain and discomfort after taking natural supplements has increased by nearly 40% over the past 10 years. According to the American Gastroenterological Association, people over the age of 50 are more frequently diagnosed with erosion of the stomach lining and ulcerative conditions. These issues are caused not only by medications, but also by overuse of harsh natural substances, including garlic. One of the most concerning examples was detailed in a report published by the Mayo Clinic in 2022. The report examined data from 172 patients who regularly consumed freshly squeezed garlic juice or garlic tinctures on an empty stomach. More than 70% of them experienced signs of stomach irritation, such as burning sensations and sharp pain. In 39 cases, endoscopy revealed ulcers or internal bleeding. Concentrated tinctures prepared at home were particularly dangerous, as patients believed that doing so would enhance the healing effects. A real-life case described in a report from a clinic in Minneapolis clearly illustrates these consequences. Rita Henderson, 54 years old and a suburban resident, began drinking garlic tincture every morning, dissolving 2 tablespoons of crushed garlic in warm water. After 3 weeks, she developed sharp pain in the upper abdomen, nausea, and a heavy sensation after eating. At first, she did not associate her symptoms with garlic. However, an endoscopy revealed an ulcer on the front wall of her stomach along with areas of active mucosal irritation. After discontinuing the tincture, following a special diet and taking protective medications, her condition stabilized within a month. Doctors at the University of Washington also pointed out that allicin and other sulfur-containing compounds, when consumed on an empty stomach, can act as irritants, especially in individuals with already weakened stomach linings. This effect is comparable to that of aspirin or alcohol, but the difference is that very few people suspect that something as common as garlic could be that harsh. If you're used to consuming garlic in the morning, especially in the form of tinctures or juice, it is time to reconsider this habit. Never take concentrated forms of garlic on an empty stomach. The best option is to eat garlic with meals as part of stews, soups, or salads. Heat treatment partially neutralizes the aggressive compounds, making garlic gentler on the stomach. For those with gastritis, high stomach acidity, or a diagnosed ulcer, it is strongly recommended to avoid raw or concentrated garlic entirely, particularly in the morning. Problem 3. Disruption of gut microbiota from frequent garlic consumption. Recent data on the health of Americans reveals a troubling trend. The number of people experiencing gut microbiota imbalances is increasing every year. According to a report from the National Institute of Diabetes and Digestive and Kidney Diseases in the United States, more than 60% of Americans over the age of 50 report bloating, irregular bowel movements, food intolerance, and a general sense of weakness after eating. And fast food or antibiotics are not always to blame. More and more often, doctors are pointing to the impact of aggressive natural foods, and garlic is among them. Garlic is widely known as a natural antiseptic. Its ability to destroy bacteria has made it a popular remedy for colds and inflammation. However, this same property, when used regularly, can also harm beneficial gut bacteria, which are essential for supporting immunity, digestion, and even emotional well-being. This was confirmed by a study conducted at the University of Virginia. For 1 month, 120 volunteers between the ages of 40 and 65 added fresh garlic to their diets, at least 1 clove per day. By the 3rd week, 41% of participants showed signs of dysbiosis, reduced diversity of gut flora, dominance of harmful bacteria, and a drop in levels of lactobacilli and bifidobacteria. Many also experienced digestive problems, fatigue, and even irritability. One of the study's authors, gastroenterologist John Clemming, noted, "Garlic can act like a natural antibiotic, but using it daily without probiotic support disrupts the balance." This is also supported by clinical cases. In Seattle, a patient named Loretta Spears, 62 years old, visited a clinic complaining of chronic diarrhea, bloating, and weakness. For 2 months, she had been adding chopped garlic to salads and morning juices, believing it would prevent inflammation. A stool analysis and microbiota test revealed a sharp decrease in beneficial bacteria. After consulting with a gastroenterologist, starting on probiotics and completely eliminating garlic for 3 weeks, her condition stabilized. Garlic is a powerful natural antiseptic, and this is both its strength and its potential risk. To avoid damaging your gut microbiota, it is important to limit garlic consumption to 2 or 3 times a week. The best approach is to add it to cooked meals after heat treatment rather than eating it raw. If you do choose to use garlic regularly, be sure to include foods with live probiotic cultures in your diet. Unsweetened yogurt, kefir, fermented cabbage, miso soup, or kimchi. This will help maintain healthy gut flora and prevent digestive problems. Problem 4. Garlic can cause a sudden drop in blood pressure and slow blood clotting. Each year in the United States, there are more than 1 million hospitalizations related to blood pressure disorders. According to statistics from the Harvard School of Public Health, about 62% of people over the age of 60 take medication to lower blood pressure, and 41% also use natural remedies without realizing the possible interactions. Garlic, being one of the most popular home remedies, often becomes the trigger for unexpected and dangerous reactions. A scientific study conducted at the University of Texas Health Science Center in Houston revealed a direct correlation between garlic consumption and reduced blood pressure in patients taking antihypertensive drugs. The study involved 148 individuals between the ages of 55 and 70 who regularly took calcium channel blockers or angiotensin-converting enzyme inhibitors. Half of them added 2 cloves of fresh garlic to their meals every day. By the 2nd week, 80% of that group experienced a drop in blood pressure below the physiological norm. Some cases were accompanied by dizziness, weakness, and even brief loss of balance. The reason was the enhanced vasodilating effect of garlic's active compound, allicin. This risk is also reflected in real-life clinical practice. In Austin, Texas, a 60-year-old patient named Gerald Miller was prescribed a standard dose of losartan for hypertension. That evening, he ate spicy chicken soup with a large amount of fresh garlic. Within 40 minutes, he began feeling severe dizziness, had blurred vision, and collapsed in the hallway of his home. When the emergency team arrived, his blood pressure was recorded at 90/55 millimeters of mercury. He was taken to the intensive care unit with a suspected orthostatic collapse. Only after reviewing his food diary and speaking with a cardiologist was it determined that the combination of the medication and garlic had caused critical blood vessel dilation. But the danger of garlic is not limited to its blood pressure lowering effect. There are other risks that many people are unaware of. In Memphis, Tennessee, a 63-year-old man named Ronald Taylor was admitted to the surgical department for a scheduled hip replacement. The surgery went well, but within hours, the patient experienced internal bleeding. At first, doctors could not determine the cause, as he was not taking any anticoagulants. However, during consultation, he mentioned that he had been eating 2 cloves of fresh garlic every day for the past 3 weeks, believing it would help prevent inflammation. After reviewing his lab results, it was found that his blood clotting ability had dropped to a critical level. It turned out garlic had amplified the effect of aspirin, which he also took every night. The situation was stabilized only after a blood transfusion and dietary adjustments. If you are taking medication for high blood pressure, it is essential to discuss garlic consumption with your doctor. It is not safe to use blood pressure medications and eat garlic daily, especially in raw form. This combination can lead to rapid blood vessel dilation, fainting, and serious complications. Additionally, garlic should be completely eliminated from the diet at least 7 days before any surgery or medical procedure that involves bleeding risk to avoid excessive blood thinning. People taking aspirin, clopidogrel, warfarin, or other anticoagulants should be especially cautious about how often they consume garlic and should always inform their doctor. Problem 5. Impaired liver function from garlic overdose. In recent years, there has been a sharp increase in the number of people in the United States turning to gastroenterologists with complaints of fatigue, a heavy sensation in the upper right abdomen, and digestive issues. According to the American Association for the Study of Liver Diseases, from 2019 to 2024, the number of patients with impaired liver enzyme activity rose by 27%. In 9% of these cases, the cause was not alcohol or viral infections, but rather dietary supplements and natural remedies. Doctors paid particular attention to the overuse of garlic capsules and extracts. One of the major studies in this field was conducted at the University of Georgia. Researchers monitored liver function in 85 volunteers who took garlic extract in varying doses. After 28 days, 42% of those who consumed more than 1,000 milligrams of extract per day showed signs of cytotoxic effects on the liver. Elevated levels of the enzymes alanine aminotransferase, ALT, and aspartate aminotransferase, AST. This indicated an inflammatory process in the liver tissues, even though participants did not report any noticeable symptoms during the first few weeks. A real case documented at a gastroenterology clinic in Phoenix, Arizona, clearly illustrates the consequences of uncontrolled garlic supplement use. Sharon Lee, 59 years old, a manager at a retail company, decided to cleanse her body and purchased garlic concentrate capsules that promised to boost metabolism and remove toxins. She took 2 capsules daily for a month without reading the instructions or consulting a doctor. In the 4th week, she began feeling fatigued, developed discomfort on the right side of her abdomen, and lost her appetite. Blood tests showed her ALT level was 2.5 times above the norm, and her AST level was twice as high. An ultrasound revealed signs of reactive liver inflammation. After discontinuing the supplements and starting supportive therapy, Sharon's condition stabilized within 3 weeks, but she had to completely eliminate all plant-based concentrates from her diet. According to Dr. Paul Meehan, a hepatologist from New York Medical College, high doses of garlic can trigger oxidative stress in liver cells, especially in individuals with undiagnosed liver issues, such as steatosis or early-stage fibrosis. This does not mean garlic is dangerous for everyone, but taking extracts and capsules without proper oversight is a direct path to damaging one of the body's most vital organs. If you want to use garlic as a way to support your health, do so through food. Add it to cooked vegetables, meat, or soups. Avoid store-bought capsules and tinctures with high concentrations, especially if you already have liver conditions or take other medications. Never begin a course of garlic supplements without first consulting a gastroenterologist and getting a liver enzyme test. If you experience fatigue, pain in the upper right side of the abdomen, or a loss of appetite, immediately stop taking garlic in any form and see a doctor. The liver has no pain receptors, and the first signs of overload often appear only when inflammation has already started. Problem 6. Garlic can harm the kidneys through dehydration and irritation. The kidneys are among the most vulnerable organs in older adults. According to the American Kidney Fund, 1 in 3 Americans over the age of 60 already has early-stage kidney function decline, often without knowing it. The symptoms build up over years: fatigue, dry skin, swelling, and frequent urination. While garlic is rarely associated with kidney issues, its diuretic effect can be a hidden trigger for worsening conditions, especially when fluid intake is low. Garlic contains compounds that slightly accelerate fluid filtration in the body. In a healthy young person with normal hydration, this effect is barely noticeable. But in older adults, especially those who do not drink enough water or who take blood pressure medications, even this mild effect can lead to fluid depletion in tissues and increased strain on the kidneys. The result is dehydration, thicker blood, and reduced filtration function. A clinical study conducted at Ohio State University found that elderly volunteers with early signs of kidney insufficiency who consumed garlic on an empty stomach daily showed a drop in glomerular filtration rate after 2 weeks. 13 out of 30 participants also showed signs of mild dehydration in their blood work, specifically elevated levels of urea and creatinine. The participants were drinking less than 1 liter of water per day, which made the problem worse. Researchers concluded that even mild diuretic foods can trigger kidney overload when there is not enough fluid in the diet. This was confirmed by a case from a nephrologist's practice at a clinic in Seattle. An elderly woman named Gloria Jenkins, 74 years old, had been regularly drinking garlic in warm water on an empty stomach, believing it was a cleansing practice. After 1 month, she began experiencing severe fatigue, dizziness, and dry mouth. Lab tests revealed reduced kidney function and signs of mild dehydration. Upon further questioning, the doctor learned she drank only about 600 milliliters of fluid per day, including tea. After she stopped consuming garlic, increased her fluid intake to 1,800 milliliters daily, and followed a gentle diet, her condition improved. Experts at Johns Hopkins University in their 2023 report warned that people over the age of 60, especially those with hypertension or diabetes, should be particularly cautious with foods that have diuretic effects, even natural ones like garlic. The aging body loses its ability to quickly restore fluid and electrolyte balance, which puts stress on the kidney's filtering structures and leads to gradual wear. If you are over 60 years old, especially if you have experienced swelling, unstable blood pressure, or kidney problems, do not use garlic as a morning drink or cleansing tincture. Avoid concentrated forms of garlic, especially on an empty stomach. Throughout the day, make sure your fluid intake is at least 1,800 milliliters, unless otherwise limited by your doctor. If you notice dry mouth, weakness, or a decrease in urination volume, contact your primary care doctor or a nephrologist immediately, and stop consuming garlic until testing is done. Protecting your kidney is not only about avoiding harmful habits, but also about recognizing the signals your body is sending in time. Problem 7. Garlic can trigger severe headaches in sensitive individuals. Migraine is not just a headache. It is a serious neurological condition that, according to the American Academy of Neurology, affects the quality of life for more than 38 million Americans each year. Women over the age of 40 are especially affected. Migraine pain is typically throbbing, one-sided, and often accompanied by sensitivity to light, nausea, and visual disturbances. The causes vary from person to person, but one common factor is food sensitivity. And one of the most frequent triggers in this category is garlic. In 2022, the American Headache Society published a study involving 820 patients with chronic migraines. Garlic was identified as a food trigger in 25% of them. The reaction was especially common when garlic was consumed raw, in sauces, pastes, and marinades. The mechanism behind this lies in compounds like diallyl disulfide found in garlic, which can irritate the trigeminal nerve, one of the primary sensory nerves in the head that is responsible for pain responses. In sensitive individuals, this can set off a chain reaction in the nervous system, triggering a migraine attack, sometimes as soon as 20 minutes after eating. One such case occurred in Boulder, Colorado. Linda Keller, 46 years old, an office manager, had long suffered from occasional migraines. One day after eating lunch at an Italian restaurant where she had pasta with a rich garlic sauce, she experienced such a severe migraine that she had to call emergency services. The headache lasted nearly 10 hours and was accompanied by nausea and throbbing pain in her right temple. Dr. Raymond Steele, a neurologist at the University of Colorado Clinic, suspected a dietary trigger and recommended an elimination diet. After 3 weeks of testing, garlic was identified as the primary culprit. Once she completely removed garlic from her diet, her migraines became less frequent and less intense. Doctors at the National Migraine Research Center at the University of North Carolina also conducted a series of observations and confirmed that patients with increased sensitivity to sulfur-containing compounds in garlic more often experience neurological reactions, ranging from mild dizziness to full-blown migraines. Special caution is advised for individuals who have had reactions to onions, scallions, or other spicy seasonings. In such cases, the risk is higher. If you suffer from migraines, try a simple test. Eliminate garlic from your diet entirely for 2 weeks, then reintroduce it and observe your reaction. If you experience a headache within the next few hours or even the next day, even if it is mild, that is a strong reason to remove garlic from your daily meals permanently. Be especially careful in restaurants, particularly with dishes that include sauces, marinades, pesto, or spicy dressings. Even a small amount of garlic can trigger an attack. Also, talk to your neurologist about adding garlic to your list of personal dietary triggers to help prevent future episodes and support better headache tracking. Problem 8. Garlic can worsen gut irritation in people with irritable bowel syndrome, IBS. In recent years, irritable bowel syndrome, IBS, has become one of the most common diagnoses among middle-aged and older adults in the United States. According to a report from the American College of Gastroenterology, IBS is diagnosed in approximately 15% of the adult population, and among individuals over the age of 50, that number reaches 21%. The main symptoms include abdominal bloating, cramps, alternating diarrhea and constipation, and heightened sensitivity to certain foods. What is especially important to note is that even small changes in the diet can immediately worsen the condition. One of the most overlooked and underestimated triggers, according to doctors, is garlic. The reason lies in the presence of fructans in garlic, a type of short-chain carbohydrate that is poorly absorbed in the small intestine and rapidly ferments in the large intestine. For individuals with IBS, this causes a strong reaction: gas, cramps, bloating, and sometimes loose stools. A study conducted at the University of California, Davis clearly demonstrated this. 62 patients with a confirmed IBS diagnosis participated in the project. For 2 weeks, they ate food that included small amounts of fresh garlic, no more than 1 clove per day. By the 4th day, 68% of participants reported worsening symptoms: severe bloating, painful cramps, and irregular bowel movements. The study confirmed that even a minimal amount of fructans in raw garlic can lead to a flare-up in people with sensitive digestion. There are many such cases in U.S. gastroenterology practice. One occurred in Portland, Oregon. A woman named Joan Rivera, 58 years old, visited a private gastroenterology clinic complaining of frequent cramps and irregular stools. She had been living with an IBS diagnosis for 5 years and followed a low FODMAP diet, but had recently decided to boost her immunity by adding raw garlic to her lunch. By the 3rd day, she experienced intense pain and bloating, even though the rest of her diet remained unchanged. Dr. Haley Brandon, the clinic's physician, conducted a food test and confirmed that the fructans in garlic were the cause of the flare-up. After eliminating raw garlic and switching to garlic-infused oil with purified extracts, her symptoms disappeared completely. American researchers at the University of North Carolina, in a study focused on dietary triggers for IBS, concluded that garlic is one of the most aggressive natural foods due to its high concentration of hard-to-digest carbohydrates. However, they also noted that cooked garlic, especially in oil form, rarely causes negative reactions because the fructans are broken down at high temperatures. If you have been diagnosed with irritable bowel syndrome, you should completely remove raw garlic from your diet, especially in the form of juice, puree, or supplements. Instead, you can use garlic-infused oil that has been filtered and contains no fructans. It will add flavor to your meals without harming your digestive system. Roasted garlic is also acceptable, especially if cooked at temperatures above 180 degrees Celsius, 356 degrees Fahrenheit, since the active irritating compounds are destroyed during such preparation. In any case, before making changes to your diet, consult a gastroenterologist and keep a food diary to track your body's response to various ingredients, including spices and seasonings. Problem 9. Garlic can damage the oral mucosa when chewed or held in the mouth for long periods. More and more Americans today are turning to natural remedies, especially for seasonal illnesses. According to the U.S. National Center for Complementary and Integrative Health, about 45% of people over the age of 40 regularly use home treatments for sore throats, gum inflammation, and colds. One of the most popular options remains raw garlic. People chew it, hold it in their mouths, or even press it against the inside of the cheek, hoping for its antiseptic effect. But many are unaware that this method can lead to serious consequences for the lining of the mouth. Fresh garlic contains active sulfur compounds, most notably allicin, a powerful substance capable of breaking down bacterial cell membranes. However, its aggressive action is not limited to microbes. It can also affect human tissue. When garlic is held in the mouth for extended periods, it can literally burn the mucosa, causing chemical burns. As a result, people may experience ulcers, burning sensations, swelling, changes in taste, and even minor bleeding. These findings are supported by real-world observations. In 2023, a dental clinic in Los Angeles documented 19 cases of oral mucosal burns caused by prolonged garlic contact. 7 of these patients had used garlic for more than 3 days in a row, placing pieces of it against the inside of the cheek or under the tongue in an attempt to relieve throat pain or irritation. Upon examination, patients showed second-degree ulcerative lesions, inflammation of soft tissues, and in some cases, impaired salivary gland function. One of these cases involved a man named Craig Walton, 52 years old, from a suburb of Los Angeles. He suffered from chronic pharyngitis and, following advice from a popular blog, began chewing half a clove of raw garlic every 3 hours. By the second day, he felt a sharp burning sensation in his mouth, and by evening, his gums were red and swollen. 2 days later, he could barely eat or speak. A dentist found burns on his oral mucosa and ulcerative inflammation. Craig was prescribed a healing ointment, anti-inflammatory mouth rinses, and was told to avoid all irritating foods for 2 weeks. The treatment took more than 20 days, and only after completing a recovery regimen was he able to chew and speak normally again. Studies conducted by the Boston University School of Dental Medicine also confirm that within just 30 seconds of contact with concentrated garlic juice, epithelial tissue in the mouth begins to break down. With repeated use of garlic as a topical remedy, not only are mucosal cells damaged, but levels of protective enzymes decrease, leaving the mouth more vulnerable to infections and fungal overgrowth. If you want to use garlic for health purposes, never chew it or hold it in your mouth for extended periods. Even brief contact with its active compounds can harm the mucosa. Instead, opt for garlic in a cooked form, for example, added to warm soup or broth. If you have a sore throat, it is better to use pharmacy remedies recommended by a doctor or gentle rinses made with chamomile, sage, or baking soda. If you have already had contact between garlic and the mucosa and are experiencing burning or discomfort, rinse your mouth with warm water immediately, avoid eating, and consult a dentist as soon as possible. The mucous membrane of the mouth is extremely sensitive, and even a minor burn can lead to prolonged inflammation. Problem 10. Garlic worsens body odor and can lead to social discomfort. In today's world, where personal hygiene and social etiquette are gaining more importance, body odor is no longer just a matter of cleanliness. It plays a major role in how a person is perceived by others. According to a study by the Institute for Social Behavior at the University of Pennsylvania, around 64% of Americans admitted to feeling uncomfortable around people with strong body odor, and nearly half associated that odor with food, especially garlic. In the United States, where personal space and respect for others are highly valued, this issue is becoming increasingly relevant. Garlic has a unique chemical makeup. When consumed, it triggers complex metabolic processes in the human body that produce volatile sulfur compounds. Two of the most significant are methylmercaptan and allyl methylsulfide. These compounds not only give breath a characteristic garlic scent, but are also released through skin pores with sweat clinging to clothes and hair. These substances are not broken down by standard hygiene practices. Neither showering, soap, nor deodorant can completely eliminate them. This was confirmed by an experiment conducted at a clinic in San Diego in 2023. 30 healthy volunteers consumed 3 cloves of garlic with lunch. Over the next 24 hours, 70% of them experienced a persistent garlic odor in their breath, sweat, and on their skin. Some even reported that their pets avoided getting close to them. Moreover, for a portion of the participants, the odor remained even after showering twice with soap. Those with the most noticeable odor had slower metabolic rates and did not regularly drink enough water, both factors that, according to researchers, intensify the persistence of the smell. A real-life example from Atlanta, Georgia, shows how garlic can affect social life. Edward Griffin, 55 years old, an engineer at a large construction company, started adding 3 to 4 cloves of raw garlic to his lunch daily after reading articles about its benefits for the immune system. Within a week, his coworkers began noticing a strong odor, especially in the afternoon. One colleague even privately pointed it out to him. Embarrassed, Edward did not immediately realize garlic was the cause. Only after consulting a doctor and changing his diet did the odor disappear, and workplace interactions returned to normal. American doctors, including experts at the University of Michigan Medical Center, warn that regularly consuming large amounts of garlic, especially raw, causes the body to release sulfur-containing compounds that cannot be removed by typical hygiene routines. In addition, some individuals have a genetically slower ability to process these compounds, which makes them prone to chronic, unpleasant odor even if they do not eat garlic every day. If you have an important meeting, interview, date, or event coming up, it is best to avoid garlic for at least 24 hours beforehand. Even 1 clove can affect your body odor, especially if you have a slow metabolism. If you do not want to give up garlic completely, opt for cooked garlic. It is significantly less aggressive. Drink at least 2 liters of water daily to help flush sulfur compounds out of the body. Also pay attention to pre-made sauces, soups, and dressings. Garlic is often present even when you do not add it yourself. If the odor has already developed, activated charcoal and parsley may help neutralize it slightly, but only temporarily. That is why the best way to avoid awkward situations is prevention. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.